Today we have with us Dr. Niketa Sonavane, a practicing dermatologist since 20 years. She practices in Andheri, Mumbai. We have a lot of clients in common, and one of the reasons I recommend her is because she does an in-depth evaluation of a patient's lifestyle, nutrition, and hormonal imbalance before prescribing procedures, medications, and products. This approach aligns very well with my practice. When your doctor and dietitian communicate with each other, you get the best results. We're going to cover a series of topics on skin and hair health that are carefully chosen from real-life cases in our practice. If you think I have good skin, then I must tell you that I have been following a skincare regime prescribed by her since the past 3 years. Of course, my diet and exercise do 90% of the job. I remember how many tantrums I threw when she said it's time I follow a structured routine for my skin. I'm almost 47 and I'm so glad that I followed that advice seriously. So Niketa, my question to you is about hormones and skin and hair health. People are always talking about cortisol and stress, how it affects your skin and hair, but nobody's talking about prolactin and insulin.
Oh yes.
which are creating chaos. And I want you to talk about it today.
Yes, sure. So the thing about prolactin is that we've been seeing a major spike in people's body, the symptoms that they're getting post-COVID. That's a very surprising factor. I'm not sure whether it existed that much before COVID, but something definitely flipped around that time.
Right.
We are seeing people with inflammatory acne, hair loss, mood imbalances, acidity issues. I mean, it's literally causing inflammation, a lot of inflammation in the human body.
Right.
And same goes with insulin. Insulin has existed for a while. We know more about it than we know about prolactin today.
Right.
It causes skin tags, it causes pigmentation, hair loss, and of course many other things to the human body.
Right. So yeah, now that we know that inflammation is driving this whole scenario of bad skin and hair fall, talking about the diet. And of course, you and I have been on the low-carb journey for the longest time. And we also prescribe that to our patients and clients. So what is your take on low-carb and keto for skin and hair health, especially skin health, and I'm talking about acne here?
Yes. So the skin is the most visible organ of the body, is the largest organ of the body. Yes. And inflammation on this organ is very easily visible. It's visual. Right. So you see inflammatory acne, you see seborrheic dermatitis and recalcitrant dandruff and eczema and such flare-ups. Right. And a low carb diet and a diet that is low on dairy is very I think it reduces the inflammation in the body. So visually you can see eczemas clearing up, you can see acne getting better, you see dandruff that was not responding finally starts responding. So I think I prescribe it a lot to my patients. I take the trouble to explain to them, but I think that's going to be the future. Low carb and low dairy is really helping the skin.
Right. So I've also seen that since the last 15 years, since I got on the low carb journey and I follow the ketogenic diet, I see that my skin is far better for my age. So it does work. And I've also seen my clients' skin and hair improve the moment they start, because we do know that two nutrients, which is protein and fat in the diet, nourish our skin. Yes. And those are the essential nutrients that the body needs. Absolutely. Whereas the body can actually make carbohydrates. So we really don't need to push that in through the diet.
Yes, yes.
Okay, talking about the diet, my next question is about dairy. And I'm sure you get this a lot and I get it a lot, where all the clients who are suffering with bad skin, they come and tell me, oh, my dermat told me to stop dairy right away. So I want to understand what is the role of dairy here, because I have been consuming a lot of dairy and it doesn't affect my skin. Yes. So I want your take on it.
Yes, see, I think that dairy along with carbs causes a far more problem than dairy alone, or maybe even carbs alone. So I have seen lesser inflammation in general in vegans who are vegetarian. They're having their carbs but no dairy.
Right.
And I've also seen less inflammation in non-vegetarians who are eating carbs, who are eating a lot of meat-related protein, but dairy is not a major picture.
Right.
So I think both put together create a lot of problem. If you separate them out, it's definitely less problem. And if you avoid both of them, it's kind of the best, which is difficult to do, especially if you're a vegetarian. I do understand that.
Right. So, I think anyways, carbs is the elephant in the room, and I think that needs to go out. But like you said, if both are going together, then it's going to be more inflammatory.
Yes.
In my case, I can't completely eliminate dairy. It's a large part of my protein intake. But because I think the carbs are out, it affects me less. But yes, like you rightly said, if I also had skin issues and I was dealing with a condition, then after taking carbs out, I would still consider then eliminating dairy, which then I run through a lot of my clients, and I definitely follow their doctor's advice to them. I don't go against that, and I follow that when it's been advised to them.
Yes. I do understand that dairy does play an important role. So especially for vegetarians or even for non-vegetarians, if I'm doubting through blood tests, through checking their prolactin, that dairy seems to be a problem, I usually tell them, let's try a zero dairy period for say 6 weeks, because it takes that much time to take effect. And then in that 6 weeks, we watch the condition, the inflammation, the eczema, the acne or the hair loss, how much improvement is there. And then I leave it to the patients themselves, that how much benefit did you see? And now you decide how much of dairy you want to have or not. It's quite likely that the patients see a dramatic change and choose not to have dairy.
True. So yeah, it has to be an individualized approach. It's never one size fits all, whether it's medicine or nutrition. I think we need to do a couple of trials and see the individual's response to whatever we ask them to do. Great. So I'm now going to talk about the thyroid hormone. So we've spoken about how prolactin and insulin work, but what is your take on hypothyroidism and skin and hair health?
Yes, hypothyroidism definitely affects the skin negatively. There is sluggish blood circulation. We see puffiness on the face, under the eyes. The skin is extremely dry, parched, even in a way aging a lot faster than a person who has healthy thyroid function. So having your thyroid to be healthy and stay healthy is definitely important for skin health.
Right. So when patients come to you with hypothyroidism, do you also kind of give them a little insight into their current TSH levels and, maybe ask them to go back to their endocrinologist if they're consulting one, or just guide them with what needs to be done there?
See, if the patient has never been diagnosed prior with any thyroid related issues and we see a slightly raised TSH, I don't usually recommend putting them on the thyroid pill immediately. We try through diet and through lifestyle modifications, through certain vitamin supplementations, correct all the other vitamin deficiencies first and lower the prolactin. And surprisingly, we have seen that when we lower the prolactin, either through avoiding dairy or through, like thyroid support or prolactin support vitamins, their TSH level comes down. These are people who would have otherwise walked into an endocrinologist office and just been on the thyroxine tablet.
So interesting point here. We need to, also create an awareness about how hormones talk to each other. It's never one hormone in isolation.
Absolutely.
So it's your prolactin, your insulin, your thyroid, your cortisol. They all work together and they're creating this, scenario in your body. And we need to look at each of them in isolation, but understand that they work together. And talking about prolactin, actually, I had a female client and she's overweight. She's 35 years of age and she came to me with a high prolactin level. But, she had just done her blood reports and found out at that point, like there was no history. And after I put her on the ketogenic diet, I've seen that her prolactin levels are normal without medications. So amazing. What you said exactly about carbs just not affecting insulin, but also prolactin, and also for hypothyroidism, it works like a magic for all the hormones because we see insulin resistance even in hypothyroidism. So again, like it's linked, and therefore a low carb approach always helps to, normalize all the hormones.
Yes, I agree.